Hi, and welcome to the Pat and Matt Show. It is June 22nd. Did I say Pat and Matt? I should have said Matt and Pat. It is June 22nd, 2017. I'm Pat Walsh, and welcome to our live stream. Today's conversation includes an amazing group of thought leaders in the fields of healthcare technology and regenerative medicine. If you don't know what that term means, you will definitely want to listen in because it's going to be a great cast. Matt, why don't you introduce us to the panel?
Sure. Well, thank you, Pat. And I know that there's a bunch of people that are listening on from the LEAF group and at lifespan.io. There's over 100 people that are there at the same, like every day, that are talking about this topic. And actually, if it's okay, we can just have our panelists introduce themselves. We'll start with Aubrey.
Hi there, yes, I'm Dr. Aubrey De Grey. I'm the Chief Science Officer of Sense Research Foundation, which is a biomedical research charity headquartered in Mountain View, California. We are working on the early stage development of new types of medicine that will bring aging under truly comprehensive medical control.
Excellent. David?
So I'm Dave Gobel, the co-founder of Methuselah Foundation and currently CEO. We work diligently to bring life extension technologies into a domain where it can actually be delivered in the clinic. So our goal is to create technologies and then create companies that can actually effectuate that. Our mantra is to make 90 the new 50 by 2030.
Robin?
So hi, everyone. I am Robin Farmanfarmaian. I'm a professional speaker, author of The Patient as CEO, and I work on companies that are poised to impact 100 million patients or more. Right now, I'm working on sleep apnea, cure and cancer, and virtual reality for stroke and brain injury rehabilitation. Those are 3 companies. But I also co-founded a nonprofit in the organ banking space called the Organ Preservation Alliance. I've partnered with Dave before, which was a lot of fun. I loved working with him. And we catalyzed breakthroughs in cryopreservation and organ banking in order to solve the world's transplant shortage.
Wonderful. Dr. Mouna, we can't see the video, but are you there? If you could,
you could. I am. Do you hear me?
Yes, go right ahead.
Okay, so I'm a medical doctor and neuroscientist. And for the last decade, I have been working very hands-on on preventive healthcare, trying to prevent people from getting cardiovascular diseases and cancer through the clinic that I founded, SciLife Clinic, a decade ago. So, and today I'm working on trying to spread the word and the knowledge about health science and tech to make people more engaged and, well, trying to lead this whole movement that we're all involved with, I think, in this panel.
Yeah, excellent. I don't know, Pat, do you want to tell them who you are?
Oh, I'm just a person trying to have a nice conversation with some thought leaders and, you know, be inspired to live a long and happy life. I'm a stunt man, I'm an investor, and a lover.
Yeah, and Pat and I are cousins, and we're really going to take this format and try to just bring compelling information for that. This is the future is now. This is what's happening right now, so we're very excited about it. So Aubrey, could you lead us off and just talk about what's happening now?
Sure, thank you. Matt and Pat asked me to speak for maybe 8 minutes before we move on to the other speakers and the rest of the conversation. And they also told me that the audience is quite sophisticated in this regard. In other words, that I don't really need to spend my time discussing the introductory details of all of this. I will spend a few minutes doing that. But I decided that probably for this audience, the best use of most of my 8 minutes would be to give my current impression of the nature of the advocacy problem. In other words, the challenges that we face in getting the world sufficiently woken up to the importance and indeed the feasibility of the anti-aging crusade, so sufficiently so that we actually get on with it as fast as the difficulty of the scientific research actually allows, which is certainly not the case at the moment. All right, so there was that one slide you were going to put up. Tell me when it's up. I can't see it at the moment anywhere. Is it there? Oh, here
Coming
we go.
up.
Rock and roll. Okay, it's most of it. Okay, it has been completely messed up. Only half of it is there, and I don't know why. That's not the right one. Hang on, that's not the one I was looking at. You said slide number. Okay, I don't want that one. That's not the one I want. The one I want is one that
with the arrow down in it, right?
Yeah, it had the title "A Common Sense Alternative."
Got it. Here it comes.
Yeah, so those of you who are familiar with sense will have seen this slide many times before. That's the one, thank you. The thing that this slide tries to encapsulate is the nature of the new idea that I put forward back in the year 2000 for how to go about postponing the ill health of old age, and thereby, of course, as a side effect, extending life. And how it contrasts with the approaches that had been emphasized previously. And what it also tries to do is to emphasize why it's really incomprehensible that people ever didn't think of this in the first place, way before I did. So essentially what we have here is, first of all, a description, if you like, a definition of what aging actually is. And this definition tries to emphasize that aging is not something that is specific to living organisms. It is very much the same phenomenon in living organisms that it is in simple, non-living, man-made machines like cars or aeroplanes. Namely, that any machine with moving parts has a variety of things that it does to operate and to continue to operate. In biological terms, we call that metabolism, but it could equally be called anything else in the case of a car or an aeroplane. And the thing is that as a result of simply the way that physics works, that operation progressively damages the machine. There are various changes to the composition and structure of the machine that happen throughout the operation of the machine, throughout the lifetime of the machine. And that damage accumulates. Now, all machines are set up to tolerate a certain amount of damage without significant decline in function. And that's why you don't need to take a brand new car into the garage, you know, the day or the month after it was built, because it's still working fine, and it's going to carry on working fine for a little while before there is enough damage to be problematic. And then, of course, eventually the damage gets to be very problematic and the doors fall off or whatever. And in the case of most people, anyway, when your car gets to that kind of point where it's exhibiting what we can call pathology, you just junk it and get a new one. But unfortunately, junking your body and getting a new one is not an option. So it's a bit of a shame that we can't do anything about this. Now, the process of essentially separating metabolism from pathology, so if you like, separating being alive from being dead, can be encapsulated very simply in this diagram. One option would be to somehow slow down, as I'm trying to illustrate by the nature of those arrows, slow down the process whereby metabolism creates damage in the first place. And thereby, of course, delay the point at which the damage reaches a problematic level. Another option would be to make the body in some sense more resilient, so that even if damage is accumulating, the ill health that eventually results from that damage is delayed simply because you make the body robust enough that it can tolerate more damage than it otherwise would. Those are two options, and they are the options that have been traditionally adopted. Geriatric medicine is all about that second option, really. It's all about trying to eliminate the pathologies of old age from the body, even though metabolism is still generating more and more damage. But by definition, it's easy to see that geriatric medicine, because of that feature of what it is, is only ever going to be very modestly effective. It's only ever going to postpone the ill health of old age a little bit, because the progressively accumulating damage will make any geriatric medicine progressively less effective. Similarly, and of course this was appreciated by, this shortcoming of geriatric medicine has been appreciated by some people for more than a century. That's where gerontology comes from. Gerontology is all about trying to hit the other arrow, the other process, and clean up our metabolism. It's inspired, of course, by the fact that there's lots of variation in the living world with regard to the rate of aging, the rate of creation of damage. So if we can somehow understand and exploit that variation, we might be able to apply it therapeutically to humans and make damage accumulate more slowly in you and me. But that too has been utterly unsuccessful for a different reason, namely that metabolism is just too complicated. The creation of damage is so intrinsically and irretrievably wound up in the process of keeping us alive in the first place that it really just hasn't been an option and will remain not an option to actually tweak metabolism in such a way as to stop it creating damage without having unintended side effects. So it all looks rather grim, and indeed, as of maybe 30 years ago, maybe even 20 years ago, people in gerontology had come to the conclusion that since neither of these approaches is going to work, we might as well just, wring our hands and treat aging as a phenomenon to be just studied for fun, more or less, rather like cosmology or seismology. Then I came along and I said, well, hang on, you don't actually need to slow down either of those two component processes. Where's my slide gone? Give it back, please. No, really. So, thank you. So there is this third approach, which I call the damage repair approach or the metabolism approach. And it's all about actually repairing the damage that's the intermediate between metabolism and pathology. The idea here, of course, is that if you can do that, if you can periodically go in and reduce the amount of damage after it has been created, then you can get away with not actually slowing down the process by which damage is created, and also with not making the body more robust against damage. You can just sidestep everything like that, which of course also means that we're sidestepping our ignorance. I explained why these things are basically impossible, but it's worse than that. We don't even know how impossible they are, because there's so little that we actually understand about metabolism, and for that matter, about pathologies, actually, about the way they interact. So this way, we can just leave those things alone and therefore get away with not understanding them. And so the point here is that this is common sense. This is exactly what we currently do to keep simple man-made machines going. I, of course, often talk about vintage cars that are 100 years old. They didn't get that way because they were designed to last that long. They got that way because the people who owned them were unusually in love with them. And rather than just letting them decay and eventually getting a new one, they decided to look after them really well, really comprehensively. And they did exactly the maintenance approach, the periodic, comprehensive, preventative maintenance that simply uncouples the functioning of the machine from the eventual dysfunction of the machine. All right, so complete common sense. And it's very odd to anyone who has not spent their life working on the biology of aging that this is so hard to actually realize. But sure enough, it was. And indeed, even to this day, there are many people who work on the biology of aging and who still find this very hard to get their heads around, and they really have difficulty believing that this could work. A large part of why that is, as I'm sure most of the audience know, the fact that in order to make it work, one has to actually exploit knowledge from many other areas of biology that have not historically been seen as relevant to aging. And so a large part of what I've been doing over the past 15 years is essentially educating my colleagues and bringing them together with people from these other areas in order to get that understanding improved. And that has definitely worked to a very large extent, to the point where these ideas are essentially being reinvented by other people now with the pretense that they are original. And that's fine by me, because the fact is these ideas are now being taken very seriously by the community as a whole. And of course, there is some considerable success in certain subsets of this, such as, for example, the development of drugs to get rid of senescent cells, of course, various advances in stem cell therapy to replace cells that the body is not replacing on its own, and all that. So it might sound as though my job is more or less done. You know, I realized how we would actually do something about aging. I got the community, or at least a sufficient proportion of the community, of the expert community behind it, and we're done, right? But of course we're not, because that group of experts who want to work on this need to be supported financially in order to actually proceed at least to proceed at the pace that the science allows, and that is very much not the current situation. So various of us, including, of course, Dave and myself, ever since we co-founded the Methuselah Foundation, we have been trying to change that. And we have had modest success, but it's altogether too modest. So what I want to spend the last few minutes of my time on is simply discussing what to do about that and why it's so hard. Now, I've used various analogies over the years. I've talked about how people are, have terrible fear of getting their hopes up, and they would prefer to just carry on believing that this whole thing is science fiction and get on with their miserably short lives and make the best of them, rather than being preoccupied. And I'm sure that's part of it. And there's, people have looked at the applicability of certain other ways of thinking about this, like, for example, terror management theory, which is definitely a relevant area. People are, have been studying for some time the irrationality that people exhibit in relation to the fear of terrorism and such like, and what to do about that irrationality. And I also feel that, one really big part of this is that there hasn't historically been nearly enough people from this community that do understand the nature of the problem and the importance of it, going out there and, speaking to audiences. I've been basically doing it on my own. Of course, that is changing now, but it's not changing nearly fast enough. And I believe that a diversity of voices in this area, people saying essentially the same thing, but in their own words, will appeal to a wider range of audiences one way or another. So, I've also always been optimistic simply because of the appreciation that we don't have to persuade everybody that this is a good idea and that this is feasible. We simply have to persuade a sufficient number of people that the financial support will come in. And that has become easier in one very important way over the past couple of years with the success that we and others have had in progressing some of these projects, some of these components of the maintenance approach sufficiently far along in terms of proof of concept that they have been attractive to at least the more visionary end of the investor spectrum, with the result that we've been able to spin them out into startup companies, many of which are doing quite well now in terms of getting investment from people who are just disinclined to give money away, and so who were never amenable to helping these projects when they were being done within Sense Research Foundation. Still, though, I remain hugely frustrated. I still have to spend all of my time, on the road, giving talks, giving interviews, and generally not getting enough sleep. And it's very frustrating and demoralizing. And there was, for those of you who have access to Rejuvenation Research, the journal that I edit, you may have seen my most recent editorial, which is the thing I'm going to focus on for the last minute of my little monologue. The editorial focused on a debate that occurred in Cambridge, my alma mater, just a month or so ago. And this debate was spectacularly demoralizing because it was basically all about whether the defeat of aging would be a good thing or whether this is something to be scared of. And I was, during the debate, absolutely convinced that everything was going right. The audience was youngsters who are generally more amenable to these ambitious ideas, and the debate, the content of the debate was very positive. It wasn't just one-on-one. I had a couple of colleagues who were equally informed and articulate. The other side were really not even trying to address the problem properly. They were all philosophers talking about things and not making their cases at all, and to the extent that they were making any kind of case, the logical holes in it were enormous. Furthermore, the debate was structured in such a way that we were able to point out very clearly the nature of these logical inconsistencies and such like. So it seemed that everything was going right, but the result was that actually not only did we lose, but actually they took a poll of opinions before the debate as well, and we lost you know, a lot of people were persuaded against us, in other words, in favor of the idea that we should leave aging alone. And I took that pretty hard, to be honest, because if in a context, in a situation like that, you know, even then we can't get people on board. Then, you know, what hope is there? You know, and I'm not the kind of person to get demoralized and disillusioned. So, you know, I'm getting on with everything as ever. But we need more ideas. We need more creative input into the advocacy process. And you know, I'm giving it all I've got. But and I know that many of you in the audience are doing the same. But we need to be putting our heads together and coming up with new things. So I'll stop there. Thank you very much.
Well, Aubrey, I just want to say thank you. And listen, I just came across your talks like literally a couple months ago because I had a great meeting with David at one point. So I noticed that your YouTube talk back in 2005 has like 3 million views. So you never know. One person can make a big difference. They can talk to the right person and it'll come through. And I know that there's therapies out there that maybe, you know, patients or people that are going through stuff, they don't see it yet. They don't know about it yet. And it takes them really kind of, you know, I don't know, taking on their own knowledge to go out there and find out about, you know, stem cell therapy. I know I've seen recently there's a company called Livion that has stem cell, like they're trying to get some work done. Or, you know, there's many companies that you just got to get the patient to get more involved. I think Robin could speak to that. Robin.
Absolutely. So I talk about the patient being the CEO of the healthcare team. And just like the CEO of a corporation, where you're not an expert in marketing or engineering or finance, you hire the best experts, they do their job, and then together you decide on a direction for the company, right? But as CEO, you are the one who is responsible that the vision is carried out and that the company is successful. So I say patients need to take control of their healthcare the same way. And that's where you're going to really start to see a difference, at least on the side where the treatment plans are actually being worked on and used, right? And,
yeah, so real quickly, just to kind of tie it into what Aubrey is saying, it can be frustrating to try to find these, get the money in to fund newer scientific endeavors that'll help, but there are some that are on the that are just in the pipeline now that people can grab onto. Is that right? Yeah, you. Sorry, Robin. Yeah.
Yes, absolutely. There and I work personally on things that what I call incremental life extension. Right, so I work on different types of technologies, and patients you can get involved. I'm a severe chronic disease patient myself, and I'm working on 3 different companies. But what they'll do is extend 10 to 20 good years to your life. That's why I'm working on things like the cryopreservation piece, because 35% of all US deaths could be attributed to organ failure, right? And 80% of hearts go unused, donor hearts at the moment, let alone the fact if we could tissue engineer things, right? So that's why I want to help create the organ bank of cryopreserved organs on demand so that we can save up to over almost 700,000 lives a year and give them like 10 years of good life versus, you know, bad with failing organs.
That's fantastic. Absolutely. Yeah. So I know that we've had a conversation a little bit about steps, and Aubrey and Robin, when you're taking steps in the right direction, it might not seem like the meeting at the college was going well, but it might be that step ends up being transformational in a way that is like beyond. So I know, Robin, I heard you speak something about that. Maybe you could share a little bit.
Sure. So absolutely, it can just come down to one major thing, dramatically changing the direction you go into or dramatically helping change your life. For me personally, it was a couple of things, like one, just walking into the right people at the right time at a conference in a lobby, right? And that's how I became involved with Invicta Medical, which is a sleep apnea data-driven platform device. And it's a $10 billion market with 100 million patients worldwide. Like that, just like bam, and that changed my life course. The other thing that dramatically changed it was just publishing a book. And once my book published, I've had over 50 speaking engagements in the past year and a half. And for a significant amount of them, I'm charging between $10,000 and $20,000 for a main keynote. So that was a big life changer for me. And I meet more and more people by being a professional speaker.
Yeah, that's fantastic. Well, I know that we have a couple other guests. I'd like to hear from them as well. And Dr. Mouna, I understand that you need to leave the call fairly soon. So maybe you could jump in and let us know what's going on for you.
Yes, sure. I'm just thinking a bit about what Aubrey and Robin are saying here. And I think that, you know, the work that is done for the life extension part, I think Aubrey's team are doing, you know, great work. And I think the problem is really beyond that. I think that, you know, even the kind of work that I was doing, which is not really extending life in that sense, but is more preventing things that lead to premature death. You know, like 7 out of 10 people actually die from cardiovascular disease and cancer in the Western world, which are diseases that we do know how to map and prevent the absolute majority of these cases. And even there, it wasn't obvious for people that this is the way to go. So, you know, a decade ago when we started SciLife Clinic, people were really, you know, they thought we were crazy doing this kind of thing. Yeah. And it was like, you know, I don't know if you had that expression, it was like swearing in the church. Do you say that? It was like really that, yeah. Appropriate somehow. But today, everybody, you know, in all the panels and things that I'm in, you know, standing next to people from, so the hospital directors of Karolinska and so on, everybody agrees on that. This is great. So I believe that we have been able to move this whole thing a bit, but it's really not satisfying, even when it comes to prevent premature death, which is really interesting because as a neuroscientist, I really understand where this fear comes from. And it's exactly like Aubrey is pointing out. I mean, it's quite irrational. And that is a problem in itself because we're dealing with a lot of irrational beliefs, a lot of irrational behaviors, and so on, which actually is somehow, you know, killing people, because when people don't behave, they don't want to open their eyes really to see this. So we are stuck with a very old brain that does not even take this very rational steps towards where we should go. So I think that from, you know, before I was thinking a lot that you have to, well, if I prove with my concept at SciLife that by checking everything from genes to scanning people and so on and so forth, I can show that we are actually preventing diseases, and then, you know, hospitals would do the same, the healthcare system will follow, and so on. But I think, you know, that whole system is so slow that for anything to really happen, we have to make ordinary people really engaged. Yeah. So we have to, you know, top down is not going to work. We have to really make a movement where everybody, and I think that we are at the beginning of that somehow, because people are realizing more and more, just like Robin is talking about the CEO of, you know, patient CEO, is because, well, today, actually, if you go to your doctor, they are not really good at following what is going on because it's going so quickly. So it is really difficult for doctors. So there's both a problem of actually being able to keep up with the fast pace of technology, but it is, and then you also have the mindset problem, you know, that they are so stuck in their way of thinking that they have been doing for the last 30 years. So I think that in a way, what we should do is to find really good ways of communicating. Not only, unfortunately, I think, you know, we all agree here, and I also think that everyone listening to us now, they also agree on that, you know, this is the way to go. But I think we have to start speaking in a language that makes everybody understand what we're talking about. So that's also something that I really try to do with, you know, my sessions on sort of Swedish, similar to the Today Show in Sweden, where I really try to speak it in a way that a 5-year-old or 10-year-old would actually understand it. And I think that's something we should keep in mind, that when people don't understand something, they become afraid of it. And then, you know, So yeah, I think it's a challenge, but I also think that we have better tools than ever, and the timing is really right now. We have to strike now because people are getting more aware of it. Technology is in favor of this whole movement, sort of. So we just have to find more efficient ways of communicating it.
Well, yeah, go ahead, Pat.
That's very well said. I mean, for me, I'm no, no scientist or anything close to it. But when Aubrey was talking about cars and comprehensive maintenance, I'm like, I'm there. I'm like, yes, I'm digging this. Yeah. When I heard about the Methuselah Foundation, and I'm like, these guys want to make 90 to new 50. Like, I'm in. I'm 51 years old. Like, I want to make this happen. I also see that my father was a professional athlete. I saw him diminishing. I was trying to cheerlead him on and go, come on, Dad, you got to do this. We got to do, let's get on the Stairmaster or whatever. And, I would do anything to have my parents back who passed away in the last few years, both passed away in the last few years, for even another year or 2 years. So I asked a woman last week, she's a stunt girl. And I said, she's actually from Japan, and they're supposed to have a pretty, I guess, the highest rate of, average
longevity,
the longest, right?
Yeah.
So I said, I got this cool company called Organovo, and these guys are doing such interesting stuff. Like, I'm in it. I'm sold in it. I'm passionate and I'm learning. And granted, I don't understand everything that Aubrey's talking. I listened to like 3 or 4 of his talks, but it starts to seep in, and then you start to care about it, and then you can inspire others. Because I have 30, 40 people talking about companies like Organovo. They're part of the conversation. They're excited not only because it can make money, but I keep focusing in on the science itself and the lives that it can save. So when you guys are all talking, you guys, professionals in this industry, it's hit me, and I can be influential in the conversations that I have. So it's not being unnoticed, and it's back to that woman. She said, I don't really want to live a long time. And I couldn't understand that. I had this conversation with her, and I'm thinking, what do you mean you don't want to live a long time? Do you not feel like you have anything to give back? I mean, I would like to live 1,000 years if I could. I feel like that my knowledge is only going to grow, and I might shift and change. I might even do a 180, but yet I'm passionate enough about life that I'm going to influence some people or make them think or something.
Yeah.
So
absolutely, Pat. And Pat's mom and my mom were sisters, and they both died with Alzheimer's. So that sort of damage that accumulates and creates that, it robs you of the person for, they just diminish in a way, and you don't get that vitality that they had. So all of these therapies, and I mean, there was one question from, well, actually, let's hear from David, because I think he's working on something now that'll help a breakthrough in one area. What's going on, David? We don't have any volume for you. Oh, sorry.
How's that? First of all, I'd like to thank the friends. One of the key things that I've heard from this is that Pat says that we're professionals in this field. Well, seeing as how there was no field, and if anybody called it a field, they would leave you in the field and hope that you'd stay away from them. Well, that was a great compliment, and it shows progress. Thank you. So in regard to how we maybe differentiate ourselves, specialize so that we're not all trying to do the same thing, which would be a waste of mutual effort, where Methuselah Foundation has been focusing its efforts is in creating a falsifiable goal. Not we're going to cure cancer, but by 2030, we want people who are 90 to feel like and be functionally equivalent to a 50-year-old. We could fail, and that's good, because it directs everything we do to achieve that mission. Whether we succeed or fail, Pat, if by the time it's 2030, you're 55 instead of 50, you'll probably be okay with that. So a near miss of an audacious goal is fine with us, but we would rather achieve people. So how are we going to do that? Well, you mentioned Organovo before. In 2009, we were the first investor in Organovo. And at that time, it was science fiction. Today, it's a public company, and it produces 2 products that you can actually buy if you're in the research community: 3-dimensional human tissues for toxicology testing. Prior to those assays of human tissues, the only way you could test a drug was in a petri dish or in mice and such model animals. And I don't know if you've noticed it lately, but you're not a mouse. And 95% of the time, things that work in mice do not work in people. So it's idiotic, but it's what could be done then. And here we are in 2017, and we have actual human kidney and liver tissue that can be used for toxicity testing. And Organovo has announced that within 3 to 5 years, they will be creating liver patches to attach to dying livers in real human beings that will get them bridged to live, which is good. Yay. So in the meantime, we keep our eyes open for other opportunities where a technology has the chance of avoiding the white cliffs of Dover, known as the regulatory structures that typically kill most biotech companies before they ever have a chance to fly. One of the ways we do that is we seek companies that can get to revenues within 18 months. That's a very hard filter, but it's a way of getting companies that actually are serious about delivering products to the clinic or to the research community, and that allows us to recycle the funds. That has worked reasonably well. Our multiple gain on the first investment in Organovo was 43 times. That was nice. And that allowed us to fund our next prize, which was the liver prize. $1 million prize for the creation of at least 1 centimeter large 3-dimensional liver tissue that could keep a model organism above the size of a rodent alive for, I think it's 90 days without medication or intervention. So recycling those funds is good. We're also partnered with NASA to do a tissue engineering challenge, which is to microvascularize successfully a 1 centimeter volume of tissues, which is the rate limiter right now. If you were trying to fly in 1902, it's easy to fly in 1902. It's just really hard to not die while you're doing it. So the Wright brothers were the ones who invented 3-axis control, so you could control the airplane and land it. So microvascularization is the rate limiter that this prize is attempting to break through. Recently, we've invested in 2 additional companies. We're co-investors with the SENS Foundation on Ocean Biotech, which is developing a platform that can deliver Boolean constructs to the interior of cells, measure protein expression, and determine what to do based on that discovery.
Great.
And the result might be the removal, the ablation of senescent cells. We have shown that is eminently possible. We're doing it. And recently we've turned our attention to various forms of cancer. So I can't tell you too much about it because it's still a reasonably stealthy company. But let's just say, wouldn't it be nice if you had a chemotherapy that only affected the cells that needed to be killed and left every other alone? That's all I can say. But that would be good, wouldn't it? The next company that we've invested in is a company called Leucadia Biotherapeutics. And Leucadia Therapeutics is working on a technology that could diagnose Alzheimer's non-invasively and in time to predict whether or not you're on your path to getting Alzheimer's, possibly before symptoms appear. In addition, this same technology has, I would say right now, it's a 70% chance of curing or preventing Alzheimer's by a similar pathway as a diagnostic. We are going into animal trials in about 60 days. And by the end of this year, we could be in safety trials, phase 1 safety trials in humans, because the approach is an operation, not a drug.
That's fantastic.
So minimally invasive operation. We're not going to slice the top of your head off and put a blender in there.
Might help Pat.
What's that?
I was just saying that might help Patrick. Yeah.
Too late. Yeah.
Right.
So because this model seems to be working very well, we've opened up a new venture called the Methuselah Fund. And this is a angel capital. You should think of it as mission capital, not venture capital. Because since it's owned by the Methuselah Foundation, we're not allowed to, I'm not allowed to get rich at this. I'm only allowed to make a salary. And so we're inviting people who've been working with the mission for a long time, who've been donors, to essentially buy a lottery ticket on these companies through the M Fund. And that is a two-pronged strategy. Obviously, the first part being to recycle the funds into the mission. The second part is to turn up the potentiometer to 11 in the investment community's greed gland. So this is, in a sense, a point of social engineering. Yeah. If you develop a track record that says, if you put in 30 cents, you can get 30 bucks in 3 years, well, people are just going to be coming out of the woodwork to fund the space. And I know that Aubrey has been working in that similar space. And so it's just the next logical thing to do. Anyway, that's my piece.
Oh, that's fantastic, David. Really amazing stuff. And Aubrey, what you got something to say on that, man? What's going on with that?
Yeah, sure. I mean, David, absolutely right. Let me actually comment on it a little bit more broadly and generally. I think the overall trend to transition projects from the non-profit world to the for-profit world is one that we, even way back in the Methuselah days, when before the Methuselah Foundation bifurcated into the two foundations that it is now, even back then we were already talking very much in those terms, and that's why Dave and I set up this thing, the Methuselah Life Science Fund, as it was called back then, which was the vehicle that actually the kind of wholly owned subsidiary of Methuselah Foundation that invested in Organovo. And that remains a very big thing. In fact, the guy that Dave brought in to run that, Mike Cope, ended up being the CEO of Science Research Foundation. So the linkage is very tight. But as things have gone on in the past few years, things have really exploded in that regard. Not only in terms of the number of companies, startup companies and so on, that are in this space, but also in terms of the investment interest that is one step removed from that in the form of investing in venture funds and such like. There's now, 3 years ago, an enormously important person in this field named Laura Deming, whose main claim to fame is how young she is, decided that what she would do after being a Thiel Fellow for a while with Peter Thiel's 20 Under 20 program, she would create a venture fund focused on longevity-centric companies. And it was a very small fund. It was less than $10 million, but they invested very well. They were very instrumental in getting the initial seed funding for what's now the company that's now called Unity Biotechnology, which of course is a very big deal in this field right now. It's very much the I think it can now definitely be called the largest ever anti-aging startup, and so that was all very successful, but that was that for a long time. And it's only now, in the past 12 months maximum, that various people, including, of course, Dave again, have come along and decided that this is really the thing to do on a larger scale. And, the contacts that I have with this are, of course, quite extensive, so I'm pretty much aware of what's going on. And it's fantastic. It's not even just focused on California or even the USA. There are a couple of funds in Germany. There's one in the UK. So it's really the ecosystem that we had always imagined, but that was just a twinkle in our eye initially. Is really becoming a reality, and that of course gives me hope. But at the same time, we must always be very, 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 very alive to the risks that this will go off the rails. The obvious way in which anything in the private sector is at risk of going off the rails is being too short-termist. Any individual company that gets set up, they start out with terribly lofty goals, and they maybe, they're founded by scientists who really know what the eventual final outcome ought to be, but then they get to need investment from this or that source, and the investors end up having control, and the investors end up gradually nudging the company in a more and more short-termist direction, and the result is that the company might as well not have been founded in the first place because it delivers no value whatsoever. This has happened time and time again in this space, and I think it's only now that we have a good chance of that not happening. Fundamentally, the reason why we have a good chance of it not happening is financial, that these companies are increasingly having a chance of getting to a point of true self-sufficiency without having to relinquish the control that was possessed by the original founders. We're seeing that all over the place. A great example that I might as well mention is iCore Therapeutics, which is a company created by someone who used to work here at Sense Research Foundation for a while. He actually started out, even before the bifurcation, coming in 2008 to start our education initiative. His name is Kelsey Moody. He had a couple of other iterations. He's one of these real dynamos that I've had the great privilege to help to bring into prominence. And he's now running a company that is bringing in money very successfully, much more successfully than we could have done because it's being done for profit. And his their main focus right now, which is essentially a project that we began and worked for several years on macular degeneration, it has a very good chance of being in clinical trials within the next year. So, this is the kind of thing that...
I'm sorry, I was just going to say, I was reading about stem cell and macular degeneration. I wonder if that's it.
Yeah, no, this is actually not a stem cell therapy. This is a therapy that is kind of complementary to that. So so just a little bit of science here. When you are suffering macular degeneration, what's happening is that there are two types of cell in the back of the eye which are dying. One of them is the photoreceptor cells, the cells that actually do the chemistry of vision, that absorb light and turn that into electrical impulses and so on. And the other one is kind of support cells called retinal pigmented epithelial cells, which sit behind the photoreceptors and essentially allow those photoreceptors to get rid of garbage. But that means that the garbage comes into the RPE cells, and so they have to get rid of it. And there are certain types of garbage that they can't get rid of. So essentially the work that iCore is doing is to augment the ability of those RPE cells to break down garbage, and thereby, so that those RPE cells do not die. If those cells do die because of too much garbage, then the cells that they are supporting also die pretty soon afterwards. And so, in principle, one can solve this problem completely using stem cell therapy, but it would be a rather complicated stem cell therapy that involved replacing both of those types of cell, and that has not yet been done. And it's not clear how difficult it is. So these are alternative routes to the same outcome, and they're both very promising and therefore very, very lucrative.
Cool.
Now, I should say before I stop, I've got to go in like 2 minutes, I'm afraid. I have to have a hard stop at 12 o'clock, but thank you very much.
Thank you so much. We hope we can talk to you again.
This is Marvin.
Yeah.
I have a few questions that people are dying to ask Aubrey before he goes, so I just wanted to make sure that they got asked. I only have time maybe to get two of them, but okay. One of them is Aubrey. For those who can't donate but want to advocate, what is the what do you advise the average person to do?
Very simple. Learn the right answers. It is appalling to me how many supporters of this mission there are who just don't know what to say in response to this or that concern. The concerns that are raised, of course, fall into many categories. I mean, just like at the top level, they fall into concerns about feasibility and concerns about desirability of this mission. And of course, those two things are very, very tightly wound together. People are resistant to hearing about either of those because they have an opinion about the other. So one has to get pretty good at embarrassing people into addressing those two questions separately rather than as a unit. But on top of that, one has to actually, you don't have to know as much science as I know. You just have to know the very fundamental things about, like the kind of thing I said over that one slide today, right? You just have to know enough to be able to explain the common sense logic of why it should be feasible to do this, as well as, of course, having some sense of the rate of progress, give some examples to use to demonstrate that this progress is really occurring. All of that stuff is really all you need in order to really, overcome people's conviction that this is just science fiction and always will be. And at the same time, you've got to have the right answers for the desirability questions. Do not bloody tell people that they shouldn't need to worry about overpopulation because we can all emigrate into space. I don't even know whether that is probably. First of all, it's technologically a pretty stupid answer, but even if it were a good answer technologically, it's a ridiculous answer rhetorically. And, this is only one example. So go and bloody listen to what I say in response to these questions, because I've been doing this a very long time and I know what works better and what doesn't work better. And if you've got the right answers at your fingertips, you will be much more effective as an advocate.
And one more thing, Aubrey, one thing that stood out to me when you were, I think it was the Joe Rogan podcast, that you were saying that you believe that you can affect a change. Is it for, I guess now the standard is for every decade, it increases 1 year, the life expectancy? Is that what happens now? But you think that you can even do one per year?
So you've got that pretty much right, yes. At the moment, in the industrialized world, the rate of increase is roughly 1 year per decade. You'll hear numbers in the region of 2 to 2.5 years per decade bandied about, but that's really a kind of statistical distortion. And yes, we need to fix that. We need to get up to this thing called longevity escape velocity, where we are increasing the longevity by 1 year per year. But even that is kind of a it's kind of a headline. It's kind of an oversimplification. And it's very easy to understand the logic of this. You just have to take into account the fact that the therapies that are actually going to work, the maintenance approach that I talked about earlier, is a rejuvenation therapy, where we don't just slow down the accumulation of damage, we actually reverse the accumulation of damage and get people back into a genuinely biologically younger state. After that, it's straightforward. However, don't talk about longevity. This is one of the biggest things that I should add to my previous answer. Insofar as you have to talk about longevity because people make you do so, make sure to say about 1,000 times, as loudly as you can, that longevity is a side effect of health, and say that this is just medical research dummies, and this is not about trying to live longer for the sake of living longer. That is the most important thing to get through to everybody.
Hey, Aubrey, one final question. Okay. Of the 7 SENS damages, how many prototype mechanisms for treatment are either currently in trials or studies, or could have a study started within a year if funding was not an issue?
They're all in studies. If the question is with regard to clinical trials, in other words, trials in humans, then about half of them. Yes, most of the stem cell things that need to be done are already in clinical trials. There are certain types of removal of molecular waste products, like the macular degeneration one I mentioned, that are in the region of a year away. Other ones may be in the region of 5, or perhaps in the most difficult cases, like, for example, mitochondrial allotopic expression, that might be 10 years away. But we're still talking about things that are moving forward at a faster rate now than they were, and they could be moving a hell of a lot faster still if we had just a little bit more money.
Awesome, thank you. I don't know if you have time to, this is one general question that anyone can really answer.
Yeah, okay, I'm afraid I do have to run. But thank
okay.
you so much. Thank you so much, everybody, for having me on. And I hope I've been useful. I look forward to any future repetition. Bye-bye then.
See you, Aubrey.
Hey, so I guess I can ask this question to all of you, and David Gobel, you might have your own perspective, but for effective advocacy, should we be trying to get the average person to care about these scientists, or approaching, pitching influential figures first, or is it equal? Is one more important than the other?
Do you mind if I answer that, guys?
Go.
So, I'm going to use the illustration of a knife. Knives work because they have sharp points and sharp edges. If you try and go for the entire population to convince them all at once, that's not going to work, and it never has. What we found early on in our investigation of who resonates to this kind of messaging is people who can envision how to solve things in a stepwise fashion. We call them engineers. And what we have found is when we did an analysis of our donors, almost all of them were engineers, because they looked forward in time like an engineer would and said, I'm going to die. Well, now let's work backwards and see what we can do about that. It's a dispassionate way of looking at life. So we did a calculation and said, are there enough engineers on the planet? And the answer is yes, there's enough engineers on the planet to do audacious things. Once we break out, then we have existence proof, like Organovo, and we hope the additional companies that we're working on. Well, then greed can take over, and the people who have no more vision than would fit inside a thimble don't need vision anymore. Greed takes over. And as we've heard from Hollywood, greed is good. I don't know about that, but it moves things. And that in our case will be good. Aubrey mentioned something that was important, and that is so many of these companies get diverted from their mission. So we call what we do mission capitalism. And that is, it doesn't matter to us how much huge money that these companies make. What matters is if they achieve the mission. And so because we have experience in angel capital, then we're able to keep these companies from being captured too early by people whose goals in life is simply to get their 2% and 20% on a venture fund. There's a place for that, but not in these early stage companies. So Organovo is an example of a company that entirely avoided, sidestepped any venture capital. It was all angel money, and then they went directly to an IPO. If you look at the state of play now in the financial world, you'll see that there's a new vehicle called Reg A+. And that is a system that has much lower barriers to entry for people who are, let's call it, mere mortals in the financial world, so that they can invest without being an accredited investor, which you can, so if you know what that is, great, and if you don't, just wiki it and you'll find it. But it's basically a way for the mere hoi polloi not to be able to invest in incredible potential companies. So that's out of the way now. Reg A+ is a way for companies to go onto a path where they may never even need venture capital, and thus not get bent into a non-helpful direction just because of money, and can go public.
Right.
Awesome. Hey, can I ask one question of you, David? And
Sure.
It's kind of, my dad looked at one of our podcasts and he had a question and I didn't know the answer to it. So have we, as like the mission of regenerative medicine and all of its facets and getting 90 to 50, have we reached out to, say, the Alzheimer's Foundation, like big foundations that are established for funding of any of these things?
I have avoided that. Early on, we did reach out to them. And I'm going to say something that is politically incorrect. At a certain point, foundations lose their way, and they seek to be immortal as an institution. If you take the example of the March of Dimes, not to pick on anybody, but if you read the history of the March of Dimes, you'll find that the day the cure for polio was announced was the day that their money died. Well, that's kind of a tough thing for a foundation that's got a payroll. So we have, at the Methuselah Foundation, done as well as we can to avoid that potential outcome. That's why we put a deadline on what we're doing. Nothing would make me happier than for the foundation to go out of business so I can go out and have Mai Tais on my back porch in perfect health. I'm not doing this for my health, you know. Oh, wait a minute. Anyway, so we have one employee. Everything else is done by creating companies or doing grants and spinning it out. So Robin mentioned the Organ Preservation Alliance. Well, we're very proud that the Organ Preservation Alliance was, well, we were the ones who helped get it started. We were the fiscal sponsor of the organization for creating, you know, organ banking, because it's necessary, but we don't want to do everything. That's stupid. So we want to make new parts for people. We don't want to do that. A company should do that. So we try to leverage our influence by starting new institutions. Think of it as being a fire starter. Pathfinder fire starters are needed.
Right. And so is competition, because competition brings prices down and quality goes up, right? So
yep.
When I see, you know, Organova, who was the people that brought the 3D bioprinting to the industry, and then I've had friends that have invested in that, and they go, oh, well, there's more competition. And I'm like, well, competition's great because it makes it, you know, the industry bigger, and then there's more acceptance that happens. So it's really neat that there are these companies that are starting to get into all these forward-thinking sciences. And
right.
I just think I mean, I'm not really involved in the industry besides being kind of like peeping through the window and stuff. And every time I look into it, I get excited. It's very, I almost want to change my livelihood just because it's so exciting. And it's just, you know, you guys are out there pioneering new sciences that are going to save people's lives. And I think it's just awesome.
Thank you. I absolutely agree that competition is crucial. That's why I don't want to have majority stakes in these companies, because then I'll have goals in conflict. I won't like competition. But if I have minority stakes in these companies, do the best that we can to mentor them into viability and, you know, get past survival, get them to the point where they're delivering a product to somebody, well, then we're done. We need to go do something else.
Right.
And,
hey, I have another question for you, David. When we're talking about regenerative medicine right now with people, I feel like there's kind of three legs to it. One being stem cell therapy, another being kind of CRISPR. These are the big legs. I know you're working on things that are kind of happening now, but it's hard to grasp them. But just tell me if I'm on to the right thing. Stem cell, CRISPR-Cas9, and bioprinted tissue. There's other things. What am I missing, or does that sound like a decent foundation?
I come at this in an entirely different way. I don't look at it in terms of technologies, because technology has a history of having the messiah of the moment, and then 20 years later, you wonder where it happened. I'm old enough now to have lived through 4 AI revolutions. So, I mean, if there's no product, you got nothing. So I come at it from the standpoint of what does the end result look like? Not tissue engineering. Instead, new parts for people. How do we get to new parts for people that are made of meat, not plastic? Okay, now that's my end goal. Now, how do I work backwards from there to make it happen? Oshin is part of our strategy of getting the crud out. What do we need to do? We need to get the crud out. Okay. Well, how are we going to do that? So we start looking for something that will help us to accomplish an end state. And I don't really care what it might be as long as it's effective, ethical, and foreseeably affordable. Other than that, I don't have any idea of what's going to do it. And in terms of, restore the rivers is another one of our approaches. It's obvious none of us can survive if we can't deliver nutrients and oxygen and remove garbage and carbon dioxide from every last stinking cell in our body. Well, the rivers get old. They die back. That's a bad thing. So renew the rivers. That's part of the Leucadia strategy, which I unfortunately can't go into too much.
Yeah, I'm also wondering, like out there, so you have all these great new companies, and then I'm looking from let's say we take the financial perspective. There seems to be some people out there that are mucking the waters up. They're not really even legit companies, and they're out there. So are they purely doing that from a financial play? Like they're either trying to short companies and bring them down, or they're somehow they're trying to raise money, and when there's really nothing even there, because that's been a concern, with, you have these boiler room type situations, on Wall Street or whatever, and they happen, and then there's this shorting, and this speed trading and things like that. How much of that is a problem to the advancement in some of these amazing, sciences? Because ultimately, if a company doesn't have money coming in, they can't progress, right? But then if you got these guys mucking it up and ruining it, oh well, you don't invest in this company because I feel like it's not really a company. When if you visited the company or you spoke to certain people or know the science behind it, that it's legit. But there seems like there's a lot of people mucking up some of these new age technologies.
So I think that is true. And at least as far back as I've gone in my historical research, has always been true. The difference today is it's faster, easier, and cheaper. So let's say that the bad guys have a light speed scooter and the cops are on snails.
Right.
So that's nobody's fault. It's just where it is today. I'm pragmatic, at least I try to be, and that is I do not moan. I'm not saying you are, but I don't lament the way things are. I try to foresee how one can adapt to a situation and supersede it.
Right.
So one of the key ways to supersede that is not to buy stock, but to make stock.
Right. Right. Or to create more. One of the reasons why I'm even doing this, why we're doing this conversation, is that to let people understand what is going on out there, it minimizes their little echoes that they keep saying, and then the more people get an understanding of actually what's out there, that can, bottom line, it could keep your parents around for another few years.
Absolutely.
Which I think is so powerful. So once people can embrace that, then it becomes, oh, I'm not going to listen to them. Why am I going to listen to them? they're just talking nonsense for whatever reason.
Yeah.
Nonsense.
So our hope is that one's own eyes will show the proof. So if you look at me, you might have your opinion about how old I am, but the fact is I'm 64. That means by 2030, I will really want me to succeed.
Right. And I'm right with you.
So keeping that in mind, then I have a lot of work to do in the meantime, and I have to do it smart. One of the reasons for the M Fund is hopefully to channel some of the venture money into things that we hope will actually work and that are audacious enough to really move the needle. So if you don't move the needle, there's no reason to get off the couch. You might as well watch a sitcom. So even though I'm sitting, sorry about that.
So I was interested, Marvin, are there any other questions that that people may have?
Let's see, you could make a donation to the SENS Foundation or the Methuselah Foundation. You could come up with a concept that helps save people's lives and increase their joy and pitch it. But it has to move the needle dramatically to get our attention and help us to achieve our goal in 2030. I'm not allowed to mention that we're accepting investments in the Methuselah Fund. And let's see, you're a software engineer. What else? So if you're seriously interested in advancing this field, feel free to send me an email and we'll have a discussion. I have at least one idea that would be addressable solely in software. So
great. Two follow-ups. One is I guess I can get more information for you, but is switching to bioinformatics and machine learning possibly a good path to getting into longevity, related stuff? Maybe getting a master's in biofield as well.
Yeah, my feeling is I don't know.
Yeah.
So that's not especially helpful. I'm skeptical about really big things, the next big thing. I'm skeptical about that because it's kind of like, I learned this from shotguns. You can, a flock of geese flies right in front of your face, you pull up a shotgun, you fire it, and what do you hit? Nothing. So these kinds of broad descriptions of an insane field that's going to revolutionize everything, until there's a specific problem set addressed with a specific solution approach that is fundable, it's hard to say. So I still think things like CRISPR-Cas9 are still, in the waiting, the batter's box of potential. Maybe it'll be great. Nobody knows until it actually is great.
I mean, I definitely think that having more conversations is going to advance, everything, because there's a better understanding. There's more knowledge being passed around, and there's engineers, software people, or whatever. I mean, just what we're doing alone. And it's no, great, it's like just getting people together online. So Aubrey was saying, hey, I spend my time traveling around from plane to plane here and there. Why even do it by plane anymore? Why not?
I totally agree.
Why not just go, hey, look, we're online. We're kind of hacking the software a bit, and get people together, have a conversation, learn, progress, move on, inspire other people's, and that's all about, for us, we're just getting started, so we're kind of learning the ropes, and incrementally we will get better, and so will the science, and it's all about figuring out how not to do it, because that moves you forward in time. So
can I jump on that?
Yeah, Joe, do it.
So Kelsey Moody, who Aubrey alluded to in the macular degeneration space. So Kelsey was a fellow who came into Methuselah Foundation, and he said, I want to see if you feel it's a good idea for us to start a scholarship fund to help people who are undergrads move into this field. And I said, sure, I'm going to do it. And he said, I will. And I was like, that's what I'm looking for. He raised his hand and he came up with the idea. And then he went out and did it. I gave him some seed funding in order to have, the worst thing for any venture is an empty pot. Even if that's why people put $1 in the tip jar, even if it's their own money. So we primed the pump, and he did it. We had several scholarships that were awarded as a result of his efforts. Well, he's an entrepreneur, and so he started I-Corps. And not only is he doing macular degeneration, but Methuselah Foundation is an investor in another one of his efforts, and that is in carbon 60, C60 Buckminster fullerenes were tested in rats for toxicology purposes, and then the rats just refused to die.
Right.
They kind of hung around for a long time.
Yeah.
Well, that experiment hasn't been repeated. Nobody knows if it really works, but I-Corps is pursuing it, and we're an investor in that.
Yep. And even with these conversations, I mean, I'm getting so passionate about all this stuff. Just having this podcast be a success, and of course, there'll be, we'll get better as we move on. But I just feel like, I went to the University of South Carolina. They got great philanthropy, or not even say, they have a great pharmaceutical school. There's a billionaire that is their main booster. I know the president of the university. I'm hooked into the Moore School of Business, which is where I went, and it's one of the top business schools. It's like a Harvard level business program. And I participate in these groups at least, I don't know, 2-3 times a year. And there's students that are eager. There's schools that are eager to get involved with stuff like this, because sometimes it feels like they're a little bit behind. I've talked about 3D printing down there 10 years ago, 15 years ago, and they didn't really even know what it was about. Do they know what that pharmaceutical school can get involved in? Do they know, like I keep always, pushing, because I know it a little bit better than the other stuff, is Organovo. Hey, let's get Bill Kennedy. Let's get the University of South Carolina. Let's get Organovo. Let me get you into a room. I don't care about, the only thing that I'm going to win from is that you guys do some stuff, Make sure that the science wins. Go ahead, get into a room, do some great things, introducing people, subscribing to our channel, because a subscription, obviously the amount of people that tune in, things like that will help us, and we're helping others. So to me, it's like this, we're all in it together. It's not like, it's nothing more than that. We're all in it together, and everybody's trying to move it, support it when you can. I mean, we had a great panel. These guys, I mean, everybody on the panel, they're players, you know? So the fact that we got these people together.
Yep.
And they were going to participate with us. Who are we? We're nobody, but yet they want to get that voice out, and together, maybe, you know, we impacted some people, and then we move on from there. So,
well, you know, that's a key insight. Everybody starts out being a nobody unless you have the genes of the British royal family.
right.
So failing that, everybody starts out being a nobody. And then you go from there and you make your choices. In the case of your university, let them know that they can compete for the NASA Tissue Engineering Challenge for microvascularization.
Right.
It's a government prize, which means that they can go to get sponsors to help them financially. And I don't know, maybe tattoos for DuPont or NASCAR or something like that.
That's great.
Well, hey, guys, I'm gonna have to sign off. But
me too.
Listen, I hope we can do this again sometime.
It was fun.
We have one final question for David. Steve Hill from the LEAF, which is Life Extension Advocacy Foundation, as well as Lifespan.io, wants to know if the Methuselah Foundation would be interested in working more with them in the future, and basically that, you know, in any way possible, you know.
I think the answer is yes. I seem to recall having made a proposal 2 years ago to that end. So I think we already did try.
All right.
So
I'll find out more.
We're willing to try again.
Yeah.
There we go. More conversations to be had. David, really
Thanks.
Appreciate your time.
Thank you.
Nice to meet you, Pat.
Nice to meet you as well. Matt,
see
my
you, David.
cuz, always great to see you. And those of you that have tuned in, I appreciate your time. And if you can, give us a subscribe, push the subscribe button. I think it's on the bottom right. And tune into some more conversations with us.
All right.
All good.
All right.
Bye-bye.